Welcome to the AZ Health Zone Active Living Strategy Overview. The purpose of this presentation is to summarize the active living strategy and activities that are carried out by AZ Health Zone implementing agencies. I will also go over the role of the active living specialist on the state implementation team, strategy and activities, active living definition, and the tools on the AZ Health Zone website. Active living definition. You may be asking yourself, what exactly is active living and what does the work of an active living specialist look like? Active living supports policy, system, and environmental changes and encourages individuals to integrate physical movement into everyday routines, regardless of an individual's health condition, ability, or interest to engage in life-enhancing movement. Ultimately, the goal of active living is to increase access to opportunities to be able to move the body throughout the day and create safe, affordable, and social opportunities in the community. Policy, system, and environmental change, also known as PSC. Policy, system, and environments are areas targeted to make changes in a community for active living. PSC work goes beyond an individual level and is a term you will hear very often in AZ Health Zone. The SNAP-Ed federal guidance offers the following descriptions for PSCs. Policies. Policies are written statements of an organizational position, decision, or course of action. Systems. System changes are unwritten, ongoing organizational decisions or changes that result in new activities reaching large portions of people the organization serves. System changes alter how the organization or network conducts business. And last but not least, environments. Environments include the physical or built environment, which are visual, observable, economic, social, normative, and message environments. We will now take a look at the active living strategies and activities. AZ Health Zone strategies are high-level descriptions of evidence-based interventions. For active living, we have two strategies. For the first strategy, we have support development of built environment to increase access and use of community infrastructure. The second strategy we have is increased usability and access to physical activity resources and community programming. We will now take a look into the first strategy and activities used in active living. The first strategy we will discuss is the support development of built environment to increase access and use of community infrastructure. There are 5 activities to support this strategy: active living policy, walking, biking, transit networks, active transportation, development of parks, trails, and other resources, and community engagement. The first activity we will take a look into is active living policy. The active living policy contributes to the creation or implementation of state, regional, or local policies that create safer, more accessible, and walkable communities. Active living policies can aim to improve physical activity in schools, allow access and modifications to built environments, or the creation of safe streets in a community. The walking, biking, and transit activity is similar to active living policy. The difference here is that the contribution or implementation would be a part of the infrastructure improvements of the walking, biking, and transit routes. An example of this would be advocating for a new bus route that connects a SNAP-Ed eligible community to a physical activity resource or a safe walking and biking route. Active transportation encourages active transportation behavior with partnering organizations and among SNAP eligible residents. Active transportation can look like advertising the map of a safe walking and biking route to a physical activity resource. Another example could be partnerships with local businesses that encourage bike bicycle parking at workplace or transit stops. In order for SNAP-Ed residents to utilize or have access to physical activity resources, we need to develop or support development of parks, trails, and other resources. Collaborating with Parks and Rec to build a splash pad for residents is an example of executing the development of parks, trails, and other resource activities. The development of this community splash pad can encourage community health and physical activity. Let's switch over to the second strategy and activity of the focus area. Increased usability and access to physical activity resources and community programming has 4 activities: improve usability and access to community resources, shared use agreements, social support networks, and community engagement. When it comes to promoting active living in SNAP-Ed communities, the condition and access to the physical activity resources can go a long way. Improving the usability and access to community physical activity resources can be executed by improving space, features, amenities, and civilities, or access to them. This could look like adding artificial grass to a local park where there's lots of dirt and gravel, park cleanup or renovations, or adding features that allow those with disabilities to access physical activity resources. Shared use agreements are a great way to build trusting relationships with different organizations or agencies. This activity is defined as the development of a written agreement between agencies to allow communities to access resources to be physically active. An example of a shared use agreement is having an agreement with a school to allow residents to use their fitness facilities during certain hours of the day or week. Social Support Network aims to establish and support physical activity groups for adults through sustainable partnerships with community organizations. This can help encourage, start, increase, or maintain physical activity within a community. An example of a social support network could be a walking group that meets throughout the week at a centralized location within a community. And the last activity for both strategies would be community engagement. Community engagement is used in both active living strategies to implement PSC work. Community engagement is to engage residents in SNAP-Ed eligible communities in the process and planning using consulting, involving, and collaborating techniques. Community engagement from an active living lens can look like involving members of your target audience in policy change meetings or consulting with community members on the changes they would like to see in their area. Now let's take a look at what the role of an active living specialist from the state implementation team looks like. The active living specialists hold many hats that include offering technical assistance, acting as an active living resource, and providing efforts statewide. The role of a specialist is to provide resources for funding opportunities such as grants for park renovations, attending and participating in work group or committee meetings, hands-on assistance and support with active living work within the community, facilitates professional development training, webinars, and other learning opportunities. AZ Health Zone website. There are a few tools you can use from our azhealthzone.org website. When you access the site, scroll down to the bottom right and click on Collaborators. The next page shows a number of tools and resources tabs for you to explore. The second focus area on this page is active living. Under this section, you will see strategies, tools, and key contacts. Select the tools option and the website will bring you to a page that displays active living strategies and other tools. Click on the View All Tools tab that will bring you to a page where you will be able to search tools by using keywords that are tagged to active living. You will also be able to select an activity using active living strategies to search specific tools and resources. This concludes the active living focus area overview. Thank you for your time and attention. And if you have any questions or want to connect about active living, reach out to the AZ Help Zone's active living specialist. Thank you.